Have you ever been confused about female anatomy? A lot of people grow up without proper education about how the human body actually works. Because of that, many men, and even many women, have questions about anatomy that were never clearly explained. Whether you are in a relationship, learning about sexual health, or simply curious about the human body, understanding female anatomy can help you better understand intimacy, communication, and health. Hello, I'm Dr. Ella Reed, and welcome to Dr. Ella Reed Men's Health, a channel where we talk about sexual health, urology, and the science behind the human body in a clear and educational way. In today's video, we're going to break down female anatomy in simple terms so you can understand how everything works and why these structures are important. And make sure you watch until the end because we're also going to talk about the infamous G-spot, what scientists actually know about it, and why there is still so much confusion surrounding it. If you're new to this channel, make sure to subscribe for more science-based videos about men's health, sexual wellness, hormones, and urology. Now let's start with the basics. How human genitals develop to understand anatomy, it actually helps to start before birth. During the early stages of pregnancy, male and female embryos are almost identical. In fact, during the first several weeks of development, the fetus does not yet have clearly defined male or female genitals. At this stage, the fetus has two main structures that will eventually develop into the reproductive organs. These include the genital tubercle and the urogenital structures. As development continues, hormones and genetics begin to influence how these tissues grow. Around 8 to 10 weeks of pregnancy, the fetus begins to develop external genitalia that will eventually form either male or female anatomy depending on the genetic makeup. If the fetus has XX chromosomes, it typically develops female reproductive structures. If the fetus has XY chromosomes, it typically develops male reproductive structures. What is interesting is that many male and female body parts actually originate from the same embryological tissues. This means that several structures in male and female anatomy are considered homologous, meaning they develop from the same original tissue but eventually form different structures. For example, the clitoris develops from the same tissue that forms the head of the penis. The clitoral hood develops from tissue similar to the foreskin of the penis. The labia majora, which are the outer lips of the vulva, are structurally similar to the scrotum in males. Understanding these similarities helps explain why male and female sexual anatomy share many functional characteristics. Understanding the vulva. When people talk about female anatomy, many people incorrectly use the word vagina to describe everything in that area. However, the vagina is only one part of the female reproductive system. The correct term for the external genital area is the vulva. The vulva includes several structures, including the clitoris, the labia majora, outer lips, the labia minora, inner lips, the urethral opening, the vaginal opening. Each of these structures plays a different role in sexual function, protection, and reproductive health. At the very top of the vulva is the clitoris, which is one of the most sensitive areas of the female body. The clitoris contains thousands of nerve endings and is a major center of sexual pleasure for many women. For many individuals, stimulation of the clitoris is the primary pathway to orgasm. The clitoris is partially covered by the clitoral hood, which helps protect the sensitive tissue underneath. Just like the foreskin in males, the clitoral hood can move slightly and helps protect the clitoris from constant friction or irritation. A deeper look at the clitoris. Many people think the clitoris is only the small visible part located at the top of the vulva. But in reality, the visible portion is only a small part of the entire structure. Internally, the clitoris extends deeper into the body and branches into two structures that run alongside the vaginal canal. These internal structures are made of erectile tissue, which is the same type of tissue that allows the penis to become erect. During sexual arousal, increased blood flow causes the clitoris to become engorged and more sensitive, similar to how erections occur in males. Because of its high concentration of nerve endings, the clitoris plays a central role in female sexual response. Research shows that for many women, direct or indirect clitoral stimulation is necessary to reach orgasm. The urethra and urinary function. Below the clitoris is the urethral opening. This is the opening where urine leaves the body. The urethra connects the bladder to the outside of the body and allows urine to pass during urination. In females, the urethra is relatively short compared to males, which is one reason women may be more prone to urinary tract infections. Maintaining good hygiene and proper urinary health is important for preventing these infections. The vagina below the urethra is the vaginal opening, which leads to the vagina. The vagina is a muscular canal that connects the vulva to the cervix and uterus. One of the most remarkable things about the vagina is its ability to change size and shape. During sexual arousal, the vaginal canal can expand and lengthen to allow for more comfortable penetration. The vagina is also capable of stretching significantly during childbirth in order to allow the baby to pass through the birth canal. This flexibility is possible because the vaginal walls are made of elastic tissue and smooth muscle. The vagina also produces natural lubrication during arousal, which helps reduce friction and improve comfort during sexual activity. The 3 openings. When discussing female anatomy, it's helpful to remember that there are 3 separate openings in the genital and pelvic area. These include the urethra, where urine exits the body; the vaginal opening, which is part of the reproductive system; the anus, which is part of the digestive system. Although these openings are located close together, they each serve different functions in the body. What exactly is the G-spot? One of the most debated topics in sexual anatomy is the G-spot. The term G-spot comes from the name of physician Ernst Greifenberg, who described a sensitive area located on the front wall of the vagina. This area is often described as being located about 1 to 2 inches inside the vaginal canal. Some individuals report that stimulation of this area can produce strong sensations or intense orgasms. However, modern research suggests that the G-spot may not be a single distinct structure. Instead, scientists believe that the sensations associated with the G-spot may come from the interaction between the clitoris, surrounding nerves, and nearby glands. Because everyone's anatomy is slightly different, experiences with this area can vary widely from person to person. For many women, clitoral stimulation remains the most reliable pathway to orgasm. Final thoughts. Understanding anatomy helps remove confusion and misinformation about the human body. When people have accurate information about how their bodies work, they can make better decisions about health, relationships, and sexual well-being. Education is one of the most powerful tools we have for improving both physical and emotional health. If you found this video helpful, make sure to subscribe to Dr. Ella Reed Men's Health for more educational videos about sexual health, urology, and the science of the human body. And remember, taking care of your health and understanding your body is always worth the effort. I'll see you in the next video.